Dr. Farrell, one thing that patients come in for, you mentioned earlier, is pain. Pain that they have suffering in their lives and things. Is there such a thing as pain-free living, and can that be found here?
Yeah, I love that question because so many people are selling pain-free living. A patient said, "Oh, there's a YouTube video. You'd really like it. It's about neurology, da da da." And so I went and watched it, and within moments, I knew what the guy did before he ever said it, and I also knew that I wouldn't buy a bit of it because some of the first words out of his mouth are, "If you want a pain-free life." Well, anytime you hear somebody say, "If you want a pain-free life," you know they're selling you something. Because ask anybody on the planet, and no one has led a pain-free life. It's a great idea. Who wouldn't want a pain-free life? But it's not reality, because pain is a very important part of living. If you didn't have pain, if you didn't feel pain, you'd put your hand down on the stove and your hand would be burned to a crisp and you wouldn't know it. So pain is a very important thing, although we don't like it. The key is managing your structure the absolute best you can through advanced biostructural correction, standing, sitting, and sleeping. Managing your conditioning in a way that improves your body without breaking it down any more than necessary, and sustaining it. And getting those habits to be just secondary, right? If you do that, yeah, you're going to have pain, but it's going to be pain for a reason, and you can work on finding the reason, and you can go about correcting it. But nobody's going to live a pain-free life. What we can do is understand how our bodies work and run them the best we possibly can. I mean, anybody who's ever sat on an airplane knows that they're not going to live a pain-free life. We can put you in the best shape possible, and you get on an airplane seat for most everybody, and it's just going to mess you up. You're going to get off the plane going, no matter how good your body is. So what we actually teach, and what we talked about earlier with the bones moving out of place in a direction the body can't self-correct, well, that's what happens on an airplane. When that happens, it's not comfortable. Will it be horrible pain? Hopefully not. Hopefully minor discomforts. But no, it's not going to happen. But we want to optimize function. And then when you optimize function, you're going to have the best possibility for an enjoyable life.